So today we're going to talk about the Acapella device used for PEP therapy, which is positive expiratory pressure. This is going to be something that we use to help clear airway secretions in patients that can't do so themselves. These are going to be patients that have excess secretions, as well as patients that have a weak or ineffective cough. Patients need both of those two things in order to qualify for PEP therapy. So the device we're going to talk about today is called an Acapella, and you're going to make sure that you verify your physician's orders as well as do a full assessment of your patient before you begin the therapy and at the end of therapy as well. So on the back of the Acapella is where you dial the resistance. Toward the plus sign is higher resistance. You just turn this piece. Less resistance toward the minus sign. You're going to instruct your patient to sit up slightly forward and take a deep breath in and hold for 3 seconds. Then they're going to wrap their lips around the mouthpiece and they're going to exhale into the device. Then there's going to be a back pressure that's going to send vibrations down into the lungs, and then they're going to do this 10 times, and then these patients are going to do a huff cough, and then they're going to do an expiration so that they can get anything that was in the lungs coughed up. So and your patient's going to continue to do this until they've done it for 10 times, at which point they'll do 3 huff coughs. And then you're going to have them do a full force cough so that they can expel any mucus that was brought up during the therapy. You want to make sure your patient knows how to use this device so that they're going to be able to get the full benefit of it when they're doing it, when they're not being watched. So you need to make sure they don't have any questions on how to use it. Then after the treatment, you need to go ahead and do another assessment and make sure that they do in fact understand how to use the device, and make sure that they don't have any questions for you. By doing this second assessment, you might notice that the breath sounds have worsened since the beginning of your treatment. This is usually due to the secretions moving out of the smaller airways and into the larger airways. So that's a good sign that the treatment is in fact doing its job.